The opinions and views expressed on this program do not reflect those of the management or staff of Community Media of Staten Island.
Welcome to RUMC Vital Signs. I'm Alex Lutz. On our show, you'll meet the fantastic people who make Richmond University Medical Center thrive. RUMC is an award-winning full-service hospital located right here on Staten Island at 355 Bard Avenue. To learn more about the full array of services provided at RUMC, visit rumcsi.org. Other than skin cancer, prostate cancer remains the most common form of cancer in men in the United States. This year alone, about 314,000 new cases will be diagnosed, and close to 36,000 lives will be lost due to prostate cancer. Here at home, prostate cancer, the second most common cancer on Staten Island behind female breast, now has a rate of 126 cases per 100,000. Up from a rate of 120 reported from 2017 through 2021. Joining me to talk more about prostate cancer, risks, treatment, and early detection screenings available is RUMC's Chief of Urology and Chief of Robotic Urology, Dr. Michael Wilson. Board certified, Dr. Wilson graduated from St. John's University and obtained his medical degree from the University of New England College of Osteopathic Medicine. He completed his residency at Rowan University, now Jefferson Health, in New Jersey, and his robotic fellowship at Mount Sinai Hospital in Manhattan. You've been our guest before, so welcome back to the show.
Thank you for having me.
Thanks for coming on. I guess the best way to start is let's start with Prostate 101. What is the prostate gland and what does it do?
So the prostate gland, location-wise, sits in between the bladder and the pubic bone and kind of your perineum. So perineum area that's underneath your scrotum.
Okay.
It sits there, and for all intents and purposes, you can live a normal life without your prostate. However, it does play an important role when it comes to fertility, as the ejaculatory ducts, which when a male orgasms, the fluid goes through the prostate. So if you remove the prostate, then the ejaculation is affected and fertility can be affected. Now, does that mean that if you have your prostate removed, you can't father children? No, that does not mean that. There are still ways to do that. But outside of that, the prostate is more familiar for men because of trouble with urination. So prostates can get bigger over time, and because of its position, it kind of sits like a hot dog in a bun, if you will. The urethra, which is the tube that passes the urine when you expel it from the bladder, the prostate kind of wraps it around like a hot dog bun. Okay. So essentially, as men get older, their prostate gets bigger, and that bun can start to impinge on where the water goes through. Okay. So essentially, when that happens, men start getting up at night to pee more. They start, not hitting the back of the bowl anymore, more the front of the bowl on their pants, running back and forth every 20, 30 minutes. So it sounds like the prostate could be more of a problem than a benefit, but in general, for healthy males, keeping your prostate in is good. The only time we really remove it is if we're talking about prostate cancer.
Right. And on that note, how does cancer form in the prostate?
So there is a very high genetic predisposition to prostate cancer, meaning that if dad had prostate cancer, you're 2 times more likely to have prostate cancer. If your brother has it, you're 4 times more likely. And if both of them have it, you're 8 times more likely. Yeah. In general, as men get older, prostate cancer starts to develop more. There are environmental factors for people with exposures. Agent Orange has been associated with prostate cancer, so military personnel. And in general, there are studies that suggest if you live long enough, most men will end up with prostate cancer at some point. Now, there has been recent studies out of Europe that look at PSA and say, if your PSA was below 1.5 up until age 60, the chance of you getting prostate cancer is significantly lower. That's the most recent study coming out. However, there's more work to be done on that. So no one's putting that as a temple of stone, if you will.
Gotcha. So what are some of the early warning signs that you could possibly have prostate cancer?
So prostate cancer in general has no symptoms, and that's what makes it dangerous. The best way to identify prostate cancer early is knowing your family history, but also getting PSA testing. PSA testing is a simple blood test that can be done by the primary care doctor, or you can see one of the specialists that looks for a marker in your blood that can suggest if you have prostate cancer.
Does PSA stand for something?
It stands for prostate-specific antigen.
Okay.
Essentially, there's always been a debate, is it great, is it not? It's a screening test. If your PSA is high, then the concern is that it could be prostate cancer. It could also mean that you have a very big prostate. It could also mean that you have inflammation. You rode a bicycle. A lot of guys ride motorcycles. That can drive that up. So there are many factors that play a role into it. However, if you do have an elevated PSA, then it's something that you need to dig in a little bit more on. And the more important aspect when it comes to PSA is, if, as we talked about before, if you're historically a guy who has a low PSA in the 1 or 2 range, that PSA should never double in a year's time frame. So, if you're seeing your primary for your yearly physical and your PSA goes from 1 to 2.5, that's a red flag. So, there is this mark of 4 as a number for your PSA, what a lot of people use. And it's an okay number to go with. But the more concerning thing is, when your PSA is below that number, doesn't mean you're okay. It means things look okay. As long as it's not doubling in a year's time frame, then you're better.
But 4 is the kind of that's the normal range?
Ideally. It all depends on your age. One thing that nowadays, PSAs sometimes get ordered for really young people, in their 20s, which most of the time we don't order that because we don't have a lot of data to compare that to. And we would expect the number to be really low at that point. In general, the recommendation is at age 45, you get your first PSA, and then that establishes a baseline for you. And then essentially at age 50, PSA yearly with a rectal exam every 1 to 2 years.
Gotcha. So if early symptoms are nothing, what are some of the symptoms that start to develop that is usually when someone is something's wrong here?
Right. So a lot of times men start having trouble with urination, meaning that they get up at night to pee, they have a weaker stream, they may see blood in their urine, they feel like they're not emptying out, they feel like they're really straining to go. And there's a thought process in the public that urinary symptoms equal prostate cancer. They can, but they don't have to. They may be 2 separate things. You may have an enlarged prostate, which causes you to have urinary issues, but you also may have prostate cancer too. Sometimes if the prostate cancer is really bad, then you can start seeing those symptoms because it's affecting the way the urination is. But in general, there's a vast majority of the public that probably have prostate cancer. I have no idea.
Wow. So someone comes to you because of a PSA test or they're experiencing these symptoms. How do you What's that exam like? How do you diagnose?
Sure. So first thing, we would have a PSA. I tend to look back at their history of PSAs so I can see if there's a time when things started to double or change. Sometimes we don't have that. So we do have tests like MDX, which essentially is a urine-based test that tells us chance of prostate cancer present as well as a chance of it being high-grade prostate cancer. In the past, if you had an elevated PSA, you automatically got a biopsy. Nowadays, before a biopsy is done, we send you for an MRI of the prostate. The MRI of the prostate allows us to see if there's any specific areas in the prostate that are suspicious. So this way, when you do your biopsy, you can target those areas. And the MRI is similar to a CAT scan for those who don't know. It just doesn't use any radiation. And then the way we do our biopsies are what are called transperineal biopsies. Transperineal is you're under a little bit of sedation to make you a little bit more comfortable, but instead of the biopsy going through the rectum, it actually goes directly underneath the scrotum. So it goes skin, muscle, prostate. So it's a safer biopsy. Risk for infection is less than 1%. And overall, it tends to be a better biopsy. Now, you can still do transrectal ultrasounds, and we do those. And there's prep that goes along with that as well. But as long as you get the tissue, and with the advent of MRI, it allows us to see, better, essentially getting what you need to get at that point. Now, if it ends up a situation where you get diagnosed with prostate cancer, in general, the next steps after that, we tend to send you for tests to see the aggressiveness of the disease. And then we also send for what are called PET scans or a PMSA scan. It's like a CAT scan that uses a special dye to say if there's prostate cancer cells anywhere else in the body.
So, and you get the diagnosis, you determine its aggressiveness. What are the options as far as treatment? Right.
So there are many options for this. The one thing I'm very clear with, if you get diagnosed with prostate cancer, it's been there for a while. Prostate cancer is very slow growing. And in general, when you get diagnosed with prostate cancer, there's plenty of data that suggests from a 3 to 6 month time window, not much changes in that time window. So you have time to make your decisions. So you can do surgery, which is a robotic radical prostatectomy with lymph node dissections, meaning you go in, you remove the prostate, you remove the seminal vesicles, which is the organ next to the prostate. The seminal vesicles essentially store the fluid that men ejaculate. And then you can do lymph node dissections as well, and then you put things back together. Most men have a catheter. It can be anywhere from 3 days is the least amount of time I've heard somebody, but on average is about 7 days. And most people go home the next day, if not the same day. And then that's the surgical aspect. There is radiation, which there are many different types of radiation. There is brachytherapy, which most people know as seeds. It hasn't been a primary therapy recently. More people have opted for CyberKnife, which is a proton-based therapy, or IMRT, which is similar. They all have equivocal rates for treatment. But then if you're opting for radiation, something that may need to come in is hormone therapy. So when you talk about prostate cancer, the best way to liken it is prostate cancer is the car and the gas is testosterone. So what the hormone's job is to knock out the testosterone so the radiation can do a better job. So, gentlemen that are on testosterone replacement therapy, it is a very debatable topic. And most people will not give testosterone in patients who have prostate cancer because of the analogy we just spoke about. But if that is, there are some people who need immunotherapies and chemotherapies as well. There is something called focal therapy, which essentially you can target the one lesion. If it's only 1 or 2 lesions, you can target and treat those lesions. There's things called cryoablation or ablative therapies as well. Those tend not to be the first-line agents for that. And there is active surveillance. So if you have very low-risk prostate cancer or low-risk prostate cancer, just keeping an eye on it's okay. And like we talked about, prostate cancer is slow growing. But it all depends on how the staging and what categories you fall into.
And how curable is prostate cancer if it's caught early?
If prostate cancer is if prostate cancer is caught early, it is very treatable and very manageable. And the one thing I'm very clear about is no matter what you use to treat this prostate cancer and deal with it, it's not a one-time fix for anything, because there is always follow-up for these things. So the thought process of, I'm going to have radiation, I'm going to have surgery, I never have to think about this again, there's always follow-ups. You're always checking PSAs and monitoring that, because there's always chance for recurrence. A bet low, there's always a chance, so you still follow up for that. But treating prostate cancer is very good, and even if it is metastatic, people live 15, 20 years with no problem.
And our last question, how can we keep a healthy prostate?
Dietary aspect of things is what everyone always asks. The only thing that's really kind of been proven time and time again is a diet that's high in antioxidants decreases free radicals in the body and decreases inflammation. Trying to keep a healthy prostate. Make sure you're urinating well. Don't be the stubborn guy who's like, I'm just getting old. You think about when you were 20 versus when you were 50. You can still have that flow like it was. In general, get regular checkups, and there has been a study which shows that if men ejaculate 21 times a month, they have a lesser chance for prostate cancer. So there is no magic pill to keep good prostate health. If you want to take supplements, that's perfectly fine. But in general, don't smoke. Obviously, we know smoking has been linked to numerous cancers. If you know that you have a family history and you have an environmental exposure, those guys really should do their due diligence and make sure they stay on top of things. But when it comes to medicine and keeping your body healthy, it's just like your car. Checkups, maintenance, that's what you want to keep with.
Well, at least we know that a simple blood test can at least give you some idea of what's going on inside your body, and then stay on top of your medical health.
Exactly.
Well, thanks for coming on again, Dr. Wilson. Appreciate it.
Thank you for having me.
Coming on and sharing your expertise on a serious condition, but one with a chance of a positive outcome if caught early, it sounds like.
Yes.
Dr. Wilson is just one of many specialists located across Staten Island as part of Richmond University Medical Center's Richmond Health Network. If you'd like to schedule an appointment with Dr. Wilson, please call our Urology Services Center at 718-818-1400. The center is located at 1200 South Avenue in the Graniteville section of Staten Island. When we come back, we'll learn how one local organization is making a difference promoting men's health and raising awareness of the importance of early prostate cancer screening.
Hi, I'm Steve Garvey, and I'm a prostate cancer survivor. But every year, 250,000 men are diagnosed with prostate cancer, and sadly, 35,000 or more die as it spreads to bones and vital organs. I'm saved because of early detection.
That's right, Steve. And besides being the #2 cancer killer of men, prostate cancer strikes black men at double the rate of the overall male population. We cannot allow this to continue.
Come on, guys. Stay in the game. For your family's sake, for your friends' sake, and for your sake.
Please, men, go to the doctor and have a discussion about prostate cancer. Early detection leads to the best outcomes. To learn more, go to fansforthecure.org. And thank you.
We're back on RUMC Vital Signs. Since 2003, Fans for the Cure, a nonprofit organization, has been dedicated to positively influencing the lives of men by organizing medical, educational, and awareness programs focused on prostate cancer. Joining us to talk more about Fans for the Cure and its important mission is founder and Chief Advocacy Officer Ed Randall. Welcome to the show, Ed.
Great to be with you, Alex. Thanks for having me.
Pleasure to have you here. So, how did Fans for the Cure come about? How did Fans for the Cure come about?
Out of my own personal experience. I went to the doctors for my routine annual physical. Thought it was going to be routine. I was only 47 years old at the time, and I was found to have prostate cancer.
And you had no symptoms, you just went for your physical?
There are no symptoms in its earliest stages. It was stunning. And I had a procedure to remove the cancer. And when I went into my two favorite words in the English language, in remission, I said to myself, on the day I was diagnosed, I felt fine. There's a 99% cure rate of prostate cancers detected early. I'm one of those lucky guys. There could be tens, hundreds, thousands of guys out there like me walking around feeling fine, thinking they were fine, when they could be time bombs. We got to get to those guys. So I filed a 501c3 dedicated to prostate cancer awareness and education, founding at that time Fans for the Cure.
And if you don't mind me, did you have a family history of prostate cancer or nothing?
No, I lost my dad when I was a child. And back then, nobody was talking about prostate cancer. So it just came out of the blue. It was stunning, and it was life-altering, but hopefully we have turned a positive into a negative.
And how did you make the connection between the organization you wanted to form and sports?
Well, I've spent my life in baseball, and I spent 7 years in minor league baseball broadcasting, doing play-by-play, and have been on the air for decades. And what a great platform that has been to be able to promote the work of prostate cancer education and awareness. Currently, I do a weekly show heard nationwide on Sirius XM radio, heard Saturday mornings, called Remember When. It's a baseball nostalgia show. Prior to which, I spent 17 years on WFAN hosting Ed Randall's Talking Baseball. And I do television on occasion like this to promote the cause of prostate cancer awareness and education. It's a fantastic platform to be on the air. I'm the only guy in America, Alex, who stops his show every week to talk about this. On WFAN, I did it, and I continue to do it on Saturday mornings on Sirius XM, because the demographic listening to my show is largely the demographic listening to my show is the demographic that's vulnerable to prostate cancer, telling them that they need to go to the doctors. A man dies in this country from prostate cancer every 15 minutes. The American Cancer Society tells us that 34,000 men are going to be diagnosed with prostate cancer in 2025. That's enough to fill Fenway Park. So our work is helped by the fact that I'm on the air.
So how do you get your messaging out to the community? What do you do in the community to promote awareness of prostate cancer?
The community is everything to us. We have a special mission in the African American community, where the incidence of prostate cancer is twice that of the white community, and we are in African American churches and barbershops to tell the men, please, it's a simple blood test. Just go and get a PSA blood test. And at Fans for the Cure, we have a medical advisory board of dozens of the best urologists in this country. As an example, recently, and I get phone calls practically every week from people that I don't even know, saying, I think I may have an issue, can you help me? And we are here to help men do that. I got a phone call from a man in San Francisco, a guy named Mike Daly, and he said, I hear about the work of Fans for the Cure. I think something is happening, can you help me? So a couple of years ago, well, prior to COVID, we had done a couple of events with the San Francisco Giants. In one game, we had information tables at a game for their fans and employees, and also we had done an event at the Moscone Center, the convention center in San Francisco, where we had I had the general manager, who's a friend of mine, come and cut the ribbon, and we had an attending doctor there, Ben Chung from Stanford University. And so when I got this phone call, I said, give me a moment, I'll get back to you. And I called Ben Chung at Stanford and said, I got a guy in San Francisco, he needs a guy. And then I called, and Ben said, great. And then I called Mike Daly back, and he goes, how did you do this? And I said, well, these are the kinds of relationships that we have been able to develop through the years, and all these doctors have been great advocates of the work of Fans for the Cure.
And I've also noticed when we were doing our research for the show that you've got some well-known MLB names involved with Fans for the Cure. Why don't you tell us a couple of those?
Well, our chairman of the board is Steve Garvey, the very well-regarded former first baseman for the Los Angeles Dodgers and later the San Diego Padres. That developed through my work on the air, working as a reporter. Knew Steve. On occasion would interview him. And one Sunday, I came home from Mass, and my light was flashing on my phone answering machine. Hi, Ed, it's Steve Garvey. Right there, Alex, I was very concerned because Garvey had my home number. But nonetheless, he says to me, I just came out of UCLA Medical Center. I was operated on for prostate cancer.
Wow.
My father had prostate cancer, which doubles your chances.
Right.
And then he said these immortal words, I am now ready to become a foot soldier in your army.
Wow.
So it's been wonderful to have Steve aboard. Name an athlete, we have had great advocacy from people like Phil Simms and the Yankee manager Aaron Boone and John Gibbons, who's the bench coach at the Mets, and just too many people to name right now, but we're very fortunate to have their support.
And I know you've worked with RUMC on several occasions. We've done PSA screenings in conjunction, and locally, a local hero, I've gotten to meet him, and a wonderful gentleman is Jason Marquis.
Right.
Frank Minichino have also been at several events. So what are you doing in the communities outside of education? You're partnering with organizations. How, what is the message? Is the community receptive to the message you're trying to get out?
Well, we'd like to think the community has no choice but to embrace our message because we believe that no man should die needlessly from prostate cancer, that no man on his journey through prostate cancer should do so alone or uninformed. And so COVID, we have in early 2020, we have a whiteboard full of events for what we're going to do in 2020. COVID hits, we all got to hide under our desks. What are we going to do? And so with that, we decided to establish a men's support group on Zoom. Alex, 500 guys have signed up.
Wow.
This is not getting Howard Rubenstein or some huge PR agency to promote our work. On its own, organically, we got 500 men. Every other Thursday night at 7 p.m. Eastern Time, we get a portion of those men to come to our men's support group, where, as I'm fond of saying, we want to provide comfort from fear. And we also have a women's support group on Tuesdays, because let's face it, when their partners go through prostate cancer, with the effects that we heard from the doctor a little while ago, they go through prostate cancer. So the response to the women's support group, to the men's support group, has been great. We also do a podcast with doctors, with people in the public eye that have had prostate cancer. Ozzie Smith, perhaps the greatest shortstop of the
Wizard of
modern age
Oz.
defensively, prostate cancer. And here's something for you. In 1982, Ozzie was with the San Diego Padres and was traded to the St. Louis Cardinals for another shortstop named Gary Templeton. Both are now prostate cancer survivors.
Wow.
But we have had podcasts with Ozzie Smith, with doctors, with researchers, and the podcasts have been very well received.
Have you had a good response in any your outreach that you've done here on Staten Island?
Well, through the great work of your organization, we have had a wonderful response, and we treasure our relationship with you, with Dan Messina, and we look forward to many events in the future.
Great. How can people become involved with Fans for the Cure?
We're at info@fansforthecure.org, and if you need a doctor, I'm your first call, info@fansforthecure.org. If they would like to donate, support our work, we welcome that. There's a donate button there and the ability to help us financially. And I like to say we're a 7-Eleven, we never close. And whatever it is you need, whenever you need it, we are here. I toured spring training camps for 5 years in Florida and in Arizona. And I would have 150 Cincinnati Reds and 150 New York Yankees and 150 Tampa Bay Rays. And I would begin by saying, I'm the only CEO you're ever going to meet who hopes to go out of business. I hope by the time you guys get off the field today, there's a cure for prostate cancer. Until that time, I will be the car alarm you cannot turn off to tell the men in your family that they are loved and they are wanted and they are needed and they are cherished and they have a responsibility to go to the doctors. And there's no reason why not, because we want men to be able to walk their daughters down the aisle on the day of their wedding and to be able to hold their grandchildren. And we don't want any empty chairs on Thanksgiving or Kwanzaa or Christmas or New Year's. We want to keep families together.
I can't think of a better way to end the segment than what you just said there.
Thank you.
Thank you so much for all that you do to raise awareness for this form of cancer that affects, as you said, more people than they probably are aware.
Well, thank you so much, and I thank the big cleanup hitter in the sky for keeping me around in my big mouth so that we can do this work.
Absolutely. Thank you for coming on the show.
Thanks, Alex.
To learn more about Fans for the Cure, visit their website at www.fansforthecure.org. Richmond University Medical Center has cared for Staten Island and the New York City metropolitan area for over 120 years. You can help ensure that care continues by making a financial contribution to the hospital. Donations can be made in your name, the name of a loved one, or to honor a special nurse or doctor at Richmond University Medical Center. To donate, visit our website at rumcsi.org and click on the Donate button located at the top of the homepage, or you can call 718-818-2106. That just about does it for this episode of RUMC Vital Signs. Thanks for joining us. I'm Alex Lutz.
Tell the men in your family that they are loved and they are wanted and they are needed and they are cherished and they have a responsibility to go to the doctors. And there's no reason why not, because we want men to be able to walk their daughters down the aisle on the day of their wedding and to be able to hold their grandchildren. And we don't want any empty chairs on Thanksgiving or Kwanzaa or Christmas or New Year's. We want to keep families together.